All right. Good evening. Let me just check and just make sure everything is good right now. I'm getting ready to get started. Um Let me see. Hold on one second. I see there's a couple people on here watching. If you are watching live, do me a favor and just say hello down below. Oh, I see it's 4 people actually watching right now. Do me a favor and just comment down below and just let me know where you are watching from and let me know if you're ready for this exam practice. I wasn't sure if anybody was going to join live or not, but I'm happy to see that there are a few people on here. There are 4 people watching right now. So if you don't mind, just go ahead and comment down below for me. Just say hello so I know you're watching and then let me know where you're watching from and if you plan on participating too. I'm going to get started in just a moment. Um, let's see here. Am I okay. All right, and just let me know that you can hear me. Somebody, I see there's 6 people watching. Somebody do me a favor and comment down below. Let me know that you can hear me and that you can see my screen. Let me know. I'll wait just a moment. I know there's a delay, so I'll wait just a moment. Let's see. Um, I wish. Okay, let's see. Let me turn this thing. Alrighty, so I'm going to get ready to get started. So, by the title, you already know that tonight's live is CCMA exam practice, right? So certified clinical medical assistant. So this exam practice is for clinical medical assistants. So if you followed my channel and watched any of my videos before, then you know that I teach both clinical medical assistant and I teach I teach medical administrative assisting, right? So if you have not already, if you're on the administrative side, make sure you check out my CMAA. I will be doing part 2 to that tomorrow. So without further ado, we're going to get ready to get started. Before we get started, I just want to shout out a few people who have recently pass their certification. Now, I blocked out the names because I wasn't sure if they were okay with me posting their names. If you happen to be one of these people and you don't mind me shouting you out, definitely let me know. Comment again and let me know. But I want to make sure I shout you all out as you are passing your certification. It makes me feel good to know that I am some type of help to you. So definitely continue to let me know down below in the comments when you all pass your certification. So someone above said she passed. Thank you for your tips and a review. Somebody said I sure did pass it. I had asked them, did they pass? Um, and she said yes. And then down below, he said, hey guys, I passed. Down on the right side, she said I passed with a 458, which is really good because the high score is 500. So 458 is great. Thank you for your advice. And that one in the middle, I just want to shout that person out. I hope that she is watching and she allows me to actually post her name on the next video. She says, Miss K, remember you told me to come back when I passed after already taking it twice. Today I passed with a 407. God is truly amazing. Now, this was someone who had failed the test twice and she was very discouraged. And I just encouraged her that it's normal. Some people, they get it on the first try, which is great. But then some people, they have to take it a couple times. So I just encouraged her to look at those areas that she fell short on. So if you have taken a test and you haven't passed it, just, focus on studying those areas where you fell short. Okay. You got this. So again, let me know so I can shout you out. So, Anolia, I hope I'm pronouncing your name right, listening from Louisiana. Thank you for joining me live. Let's get into this. So, let's go to the first question. First question. How many primary digits does a CPT code consist of? 2 digits, 4 digits, 5 digits, or 7? 2 digits, 4 digits, 5 digits, or 7. I'm going to give you all a few moments to think about it. If you're watching a replay, just use this few moments to kind of think about it and choose your answer. If you're watching live right now, you can go ahead and you want to participate. Go ahead and put in the chat what you think The answer is a CPT code. CPT code consists of 2 digits, 4 digits, 5 digits, or 7 digits. I'll wait just a few more seconds. I have a delay, so I want to see if anybody puts the answer in the chat. CPT code. Okay, so let's see what the answer is. I don't see anybody putting anything in the chat. Let's see what the answer is. So if you thought it was 5 digits, that is correct. So CPT code is a procedure code that consists of 5 digits, right? If you happen to need to add any modifiers, then that would be a 2-digit code that you would add, 2-digit number that you would add at the end to become 7 digits. But the primary digits, it's 5 digits. All right, next question. An MA medical assistant has given a patient an injection, and the patient begins developing an itchy rash with pink lesions. Which of the following terms should the assistant use when documenting this occurrence? Is it anaphylaxis, rhinitis, urticaria, or erythema? I'll give you all a few minutes. Give you all a few minutes to think about it. Anaphylaxis, rhinitis, urticaria, or erythema. Okay, somebody said urticaria. Anybody else agree or got anything different? Oh, Anoli, I'm sorry. I'm just seeing your comment from the previous question. There's a delay on my end. I'm sorry. I'm just seeing your comment from the previous question. All right, so let's see. So if you chose urticaria, you are correct. You are correct. That's another name for hives. Anaphylaxis, that's a severe allergic reaction that can result in a patient collapsing or going into shock. Rhinitis, that's inflammation of the nasal passage. And then erythema, so that's redness of the skin, but not necessarily a rash with lesions, okay? And one thing I want to mention too, which you probably already know, make sure you all are paying attention to the answers that are incorrect as well, because let me tell you, if these other terms are an option, guess what? That means that you may see it on the test. So as we're going through these questions, definitely pay attention to the wrong answers as well, okay? Because that means that you may see a question on the test about one of those other options. They don't put these options on here for no reason. So very good, Maria. You were correct. All right. Next question. When should the code on glucose cuvettes be compared to the code on the glucometer? Before a patient is tested, after a new package of cuvettes is open, following an error code, or at the beginning of the shift? When should the code on glucose cuvettes be compared to the code on the glucometer? Before a patient is tested, after a new package of cuvettes is open, following an error code, or at the beginning of the shift? I'll wait a moment, give you all a chance to think about it. I'll put your answer in the chat box. Okay, anybody want to answer that? I'll wait a couple more moments since there's a delay. Okay, Maria says A, before patient is tested. Anybody else agree or have a different answer? Maria says the answer is A, before patient is tested. All right, let's see. Maria, you are correct. The answer is A, before patient is tested. So let's talk about this for a minute. So the glucose cuvettes, right? That the cuvettes is what you actually place the patient's blood on when you're testing a patient's blood sugar, right? So the code should be compared, even though you may have checked that code earlier that day, right? Maybe you were doing your quality control and you checked that code earlier that day. I want you all to be in the habit of checking it right before you test the patient as well. Okay. So after new package of a cuvette is open, yeah, you're going to check it. Um, when you open a new package, you're actually going to put that new cuvette into the glucometer. So when you open a new package of testing strips, you're going to put a new cuvette into the glucometer. Following an error code and then at the beginning of the shift are incorrect. You want to check before a patient is tested. Okay. Um. All right. Which of the following is the purpose of Category 2 codes and procedural coding? Is it to track provider performance measures, indicate special circumstances, works as a temporary code, or identifies preventive measures? Category 2 codes and procedural coding. Is it to track provider performance measures, indicate special circumstances? Does it work as a temporary code, or is it to identify preventive measures? Okay. Alrighty, if you chose A, you are correct. It is to track provider performance measures. Indicate special circumstances. That is actually what the modifiers are used for. Remember, I mentioned modifiers a couple questions ago. So, modifiers are used to indicate any special circumstances surrounding a procedure that the provider did. Let's just say there were two different providers who performed, well, not even necessarily just two, but more than one. If something happened during the procedure, um, um, if it had to be performed for some reason in different locations, that would be a special circumstance. All right, next question. A pulse oximeter may inaccurately measure low oxygen saturation due to the following circumstance: anemia, hyperventilation syndrome, cold fingers, or carbon monoxide poisoning. An inaccurately low oxygen reading is measuring low inaccurately. Maria says the answer is C. Anybody else want to answer? Thank you, Maria, for participating. Anemia, hyperventilation syndrome, cold fingers, or carbon monoxide poisoning. I'll give you all a minute to think about it. Okay, Deloria. Hey, Deloria. Hey, Veronica. Deloria and Veronica both says that also say the answer is C. So Maria, Deloria, and Veronica, let's see if you all are correct. And that is correct. Cold fingers. So if you're going to check your patient's pulse ox and you notice that their fingers are cold, you want to have them warm their fingers first because it can get an inaccurately low oxygen rate. The hyperventilation syndrome and carbon monoxide poison, if anything, it may give an inaccurately high reading, if anything. So it will be the actual opposite. Very good, ladies. Thank you for participating. Okay, next question. A patient begins to faint as an MA, a medical assistant, is drawing her blood. That's correct, Veronica. She says to warm the fingers first. A patient begins to faint as a medical assistant is drawing her blood. What should the MA do? Use ammonia capsule to revive the patient, apply a warm cloth to the patient's forehead, have the patient remain in the office for 5 minutes, or position the patient flat on her back. The patient begins to faint while you're drawing her blood. What are you going to do? Okay, Veronica says D, position the patient flat on her back. Anybody else? Maria and Kiera. Is that Kiera or Kiera? I'm sorry if I'm mispronouncing your name. She also says D. Brett also says D. Okay. Anybody else? I'll wait a second. All right, let's see. All righty, you all are correct. You want to position the patient flat on her back. So if you all are working in a lab, or if you're working in an office and you have to draw your patient's blood and you notice that they begin to faint, and let me just tell you, it is kind of a common thing for patients to faint. I will tell you that I worked for LabCorp some years ago, and we did get patients at least once a week that fainted or were, had a history of fainting. And so when you have those patients, if you're able to lie them down while you're drawing their blood, that would be perfect. And some patients will tell you, like, look, I often faint when I get my blood drawn. So they know. So if you have a patient that tell you, just go ahead and lay him or her down, right? For some people, it's the sight of blood. Like, I had a conversation with a patient one time, and I asked her, what is it? And she said she couldn't explain it. It's just the sight of blood. And I also asked the guy because he was tatted up. I mean, he was, he had muscles, he was tatted up, and he was afraid of the needle. And I asked him, like, how do you get tattoos and you're afraid to get your blood drawn? He says, it's just the thought of the blood coming out of my body. So, for some people, that just, it gets them, it gets them lightheaded and makes them faint. So if you do have a patient like that, just go ahead and lay them down. So that's correct. The supine position. That is correct, Veronica. Okay, good. Okay. Kiera, which one was correct? Kiera or Kiera? Kiera or Kiera? Okay. All right, ladies. And then too, I want to say applying a warm cloth, that is definitely incorrect, because if anything, you want to apply a cold cloth to the patient's forehead, okay? Not a warm cloth. All right. A patient experiencing heat stroke may manifest which of the following? Hot skin, excessive sweating, bradycardia, or slow breathing. The patient is experiencing heat stroke. Which of the following may manifest? Hot skin, excessive sweating, bradycardia, or slow breathing. Okay, Brittany says B. Maria says A. Erica and Veronica says B. Okay, let's see. Kiara says B. Kimberly says B. I'll just wait another few more seconds just to see if anybody else answers. Okay, let's see. All righty, Maria, you got it. Hot skin. Deloria also said A. Yes, so it's going to be hot skin. So if a patient is having heat stroke, it's going to be hot skin. Excessive sweating. The reason why they wouldn't have excessive sweating, because if they're having heat stroke, if anything, their skin is going to be very dry, not sweaty. There's really not going to be any moisture. Bradycardia, if anything, is going to be actually tachycardia, which is an increased heart rate as opposed to the other way around. They're not going to have a decreased heart rate. They're going to have an increased heart rate. And then slow breathing, another one that's complete opposite. They'll have increased breathing and not slow breathing. Okay, so good guess, ladies. All right. Okay. So when administering eye ointment to a patient, which of the following actions should the medical assistant take? Hold the ointment tube parallel to and above the patient's eye. Apply a thin ribbon of ointment along the conjunctival sac. Apply the ointment from the outer canthus to the inner canthus, or have the patient keep her eye open after application. You're administering eye ointment to a patient. One thing while you all are thinking about this and commenting down below, one tip I want to give you all that I always give my students, when you all go to take this test, if you're taking NHA, right? NHA gives you the option to flag your questions and come back to them. So if you ever have questions that you need to think about a little bit, you want to always flag those questions and do the easy questions first. Why do I say that? Because when you go to take this test, you get 3 hours, which sounds like a lot of time, but I've had students who literally tested up into their very last minute because those 3 hours go by quickly. So if you ever have a question that you need to think about, flag it, get through all the easy questions first, so that way, you won't run out of time. Because if you spend your first, if let's just say your first 10 questions are all, difficult questions for you and you got to think about them all, you're wasting time, right? And then you have a bit more potential to run out of time. But if you go through your easy questions first, you fly through those easy questions, then you have plenty of time at the end to think about the other one. So always flag the difficult ones first. Let's see. Okay, so it looks like everybody's saying the answer is B. Let's see. All right, so you all are correct. The answer is B. You want to apply a thin ribbon of ointment along the conjunctival sac. You're in C. I want to just point this out. This is incorrect because you're not going to go from the outer to the inner. You actually want to go from the inner to the outer. So some of these options on here, I want you all to think about this too. When you're taking this test, I want you all to really look at options that you can automatically rule out, right? So this may have been one of those ones that you can look at and say, okay, I know for sure that's not it. Because you may know just from, putting ointment on your own eye. So when you're looking at these questions, I really want you to, especially if you see a question that you've maybe never seen before, do process of elimination. Look at these questions and say, you know what? I know it's absolutely not that. So I'm going to rule out, for an example, A and D. And then you rule out A and D. And then you say, okay, this now down between B and C. Let me see. So that gives you a better chance of getting the answer correct. Veronica asks, is the NHA exam the same as the CCMA? Yes. The NHA is CCMA. Yes. Thank you for answering for asking that question, Veronica. You just made me think of something else. So if you happen to be watching and you are not taking a CCMA, you are taking the RMA or the CMA. RMA is the Registered Medical Assistant exam, or the CMA is Certified Medical Assistant. This practice test will still help you. Why? Because it's the same content. Now, the questions won't be the same, and the questions won't even be the same on a CCMA. It's the content that you want to make sure you absorb. And so I don't want anybody to mistakenly expect to see these exact questions. I want you all to focus on the content that's being presented when you're taking these practice exams, okay? But yes, NHA is the CCMA exam. Okay. Next question. How does an antitussive work? Does it reduce nasal membrane swelling? Helps with coughing up mucus? Relieves allergy symptoms? Suppresses the cough reflex? Does it reduce nasal membrane swelling? Helps with coughing up mucus? Relieves allergy symptoms? And suppresses the cough reflex? Okay. Oh, Kiara says she's taking her test on Friday. Veronica Maria says good luck. Kiara, make sure you let me know if you passed or not. I'm rooting for you. I'm rooting for you. Veronica says she heard the RMA test is very hard. Um, I'm going to address it in just a second. I'm glad you brought that up, Veronica. Okay, so Maria, Brittany, Veronica, Britt, Brett, Kimberly, you all say the answer is D. Let's see. Okay, Erica also says the answer is D. Let's see. All right, you all are correct. You all are correct. Now, what kind of medication reduces nasal membrane swelling? That would be a decongestant, right? A decongestant is what reduces the nasal membrane swelling. Coughing up mucus, that would be what we call an expectorant, okay? Relieves allergy symptoms. That would be an antihistamine like Benadryl. Benadryl is like my best friend, especially now that it's allergy season. Benadryl is literally my best friend. That's an antihistamine. So it's going to be the cough reflex. And one thing that I think about when I see antitussive, I think about that cough syrup Robitussin. Robitussin is like the best thing. It's nasty, but it's like the best cough syrup. So think about that, Robitussin. So I want to address something that Veronica said. She said that she heard that the RMA test is very hard. All right, let me just say this. So the RMA exam, registered medical assistant, and a certified medical assistant exam, I will be honest, those tests tend to be a little more difficult than the certified clinical medical assistant, the CCMA. Why? Because the certified clinical medical assistant exam, the one that we are reviewing right now, because it's the clinical certification, this exam tends to be more focused on clinical questions, even though you do get some administrative questions. But the CMA and the RMA exam is a mix of everything. It's a good mix of everything. And let me just say this, every test is different. So let's just say Brittany and Kiera, you all are both taking an RMA or CMA or CCMA, and you're sitting right beside each other. Both of your tests is going to be different. It's randomized. So none of us know whether you will have a lot of clinical questions. We don't know if you're going to have terminology and anatomy, some administrative questions. Like, it's hard to say because every test is different. But I will be honest with you and say that, yes, the RMA and the CMA are known to be a little bit more difficult because it's a wide range. Now, is it passable? Absolutely. The school that I worked at before the school that I'm currently working for, my former school, that those students took the RMA exam. And I had a lot of students that passed the test. I had students that didn't, and that's with any test. You know, some passed, some didn't. But I wouldn't get discouraged about it though. So yes, it is a little bit more difficult because it's a little bit more broader, but still passable. So I hope that helped, Veronica. All right, next question. According to OSHA's guidelines, blood soiled gauze should be disposed of in which of the following? A red biohazard bag, sharps container, trash can with clear leak-proof liner, or a purple medical waste container. Blood soiled gauze. All right, Veronica says A. You're welcome, Veronica. Brittany says, I just started class last month, so I'm starting early. Oh, perfect. Brittany, yes, Brittany, this is the best time. You just started class. Okay. So I was assuming that people watching are just about to finish class and about to take the test. So that's good. You starting early. So if you haven't already, Brittany, make sure you subscribe to the channel and keep watching because I got some more coming up. This is part 1 to CCMA. So I'll have some more of this coming. So save this video so when you get ready to take your certification, you know where to come. All right, looks like everybody's pretty much saying A, red biohazard bag. Let's see. All right, that's correct. Red biohazard bag. So any bodily fluids, any soiled items, gauze, band-aids, gowns, exam table paper, you want to dispose of that in a red biohazard bag. That is required by OSHA. And let me tell you, they will come and check. I have witnessed it, I have experienced it. They will come around, OSHA will come around and they will check to make sure you are in compliance. They will look in the trash cans. They will look in the biohazard containers. They will look in the sharps containers. So speaking of the sharps container, which was option B, what goes in the sharps containers? Needles, glass, right? Sharp objects. They will look to make sure that there's no gauze and band-aids and trash in the sharps containers. People actually do put those items in those containers, and you can get fined by OSHA. So please just make sure, ladies, when you're out there, when you're in a classroom, for those of you that's still in school, make sure you're putting things where it belongs. The trash cans are for trash, right? Non-soiled items. And regular trash. I actually had my co-teacher actually was stuck by a needle because we were cleaning up the classroom that somebody used before us that didn't clean up. He picks up a pile of trash and guess what? He got stuck by a needle. Why? Because somebody left a needle in with the trash. And so he had to go through the process of taking his medication and getting his blood drawn. The medication, if you ever have a blood draw, there's a process you have to go through. I'm sorry, a needle stick. There's a process you have to go through. First of all, you want to wash the site off first, and then you want to let your office manager know, and then you're gonna have to get your blood drawn, take this medication because he didn't know if that needle was used or not. So to prevent acquiring HIV or hepatitis, any who knows who was stuck by that needle. He had to do that, and he had a lot of side effects from the medication. So just please make sure you're discarding of items where they belong. Okay. Veronica says, I'm getting ready to go for externship and volunteering. Perfect, Veronica. I'm actually about to record a video on some externship do's and don'ts. That was something that was that was a video that was recommended. So I'm going to be doing that soon. So make sure you keep me posted with that. Erica says, does the NHA test have a lot of definitions? So it varies. When you say definitions, I'm assuming you mean terminology questions, possibly. One of my students who just passed the certification last semester, her test had a lot of terminology questions. But another one of my students, she said she saw a lot of HIPAA questions and compliance questions. So it depends. Since every test is different, it's randomized, it literally depends. It's hard to say. Okay, next question. Which of the following should be included in the appointment calendar when scheduling a patient? The diagnosis code, a daytime phone number, date of birth, or the patient's identification number? You're welcome, Erica. You're making an appointment for a patient. And in this case, you're probably using, it seems like this is a manual scheduling calendar they're talking about. Are you going to include the diagnosis code, daytime phone number, date of birth, or the patient's identification number? All right, Maria says B. Anybody else? Let's see. Okay. Okay, let's see. All right, I see Erica and Veronica also said B. So yes, the answer is the daytime phone number. So diagnosis code, absolutely not. First of all, the doctor determines a diagnosis code once he sees the patient, so we can already rule that out. Date of birth is already going to be in the patient's chart. We don't have to include that when making their appointment. Patient's identification number, not that either. Daytime phone number, you always want to get a phone number for the patient. I was just literally telling my students this yesterday in class when we were going over exam practice, because my students, my current students, are about to take the exam next week, next Tuesday. I was just reminding them, Always get a phone number for a patient. You never want to assume that the phone number on file is the current phone number, because a patient can come in today and change their phone number tomorrow, right? And move next week. You never want to assume the phone number and address and things like that is the same. So you always want to verify. Especially, if you need to reschedule the patient, the provider has an emergency and can't make it or whatever, you want to be able to reach that patient and also to confirm his or her appointment. Kimberly says, does this help with taking my CMA exam through the AAMA? Yes, it will, Kimberly, because the content. So I worked at, I mentioned at the beginning of the live that I teach medical assistant and medical office assistant. So I've worked at a total of 3 schools. The first school I worked at, the students took the CMA exam, which is the exam that you're going to be taking through AAMA. Then my second school, they took the RMA exam, and then the school that I work for now, they take the CCMA. And I can honestly say that there are the same types of questions. However, the CMA and the RMA, they're just a little bit more broader. So with those tests, you'll see a lot more administrative questions. You'll see more, questions about diagnosis codes and things like that on the administrative side, billing questions and things like that on the administrative side, than you will see on this one. So yes, this will still help. I do recommend you to still look up CMA specific questions, right? Because there's different study guides for each test. So the study guides that I get this material from is from the CCMA study guide, right? I don't have access to the AAMA study guide. So I want you to still make sure you look up the AAMA study guide. But yeah, to answer your question, yeah, this will help. Sorry, I get long-winded sometimes. My students tell me I talk a lot. I'm just the type of person, I want to make sure you get it. So I kind of repeat myself a lot. But yes, long story short, yes. All right, next question. After requesting pre-authorization for a patient's referral to a specialist, what is one reason the claim may be denied? The approved visits are listed in the authorization comment section. The patient previously submitted and received a self-referral. The specialty provider's national provider identifier, NPI, is not included in the authorization, or the service is provided after the expiration date. So I'm going to give you all a few moments to read through this and think about this. Oh, thank you, Veronica. She says you are thorough. Thank you. Thank you, Veronica. I just want to make sure you get it. I'm like this with my students. I probably repeat myself 5, 6, 10 times. Erica says D. Brett also says D. Okay. Maria also says D. Wait a few more seconds, see if anybody else's answer. All right. Here also says D. All right, you all are correct. So when the patient gets a referral, there is an expiration date. It could be 6 months, maybe long, maybe the referral is good for a year, whatever the case. You got to make sure the patient has to make sure that they schedule their appointment within that amount of time. So that would be a reason that the claim may be denied. Approved visits are listed in the authorization comment section 9. Patient previously submitted and received a self-referral. That wouldn't do anything. If a patient self-refers themselves, that just means that they didn't go through their primary care to refer themselves. They didn't go through their primary care to get referred. They referred themselves. Nothing to do with that. NPI number does not need to be on a referral. So this is not the answer. Again, as we're going through this and we're talking about these wrong answers, make sure you're making a physical note, right? You're writing it down or making a mental note of these things, right? So that way, if you happen to see it again, you'll know it, right? If it's asked in a different way, because like, as I mentioned, you won't see these exact questions, but it will be the same content. Okay. All right. When disposing of a used needle and syringe, what action should the medical assistant take? Are you going to recap the needle before disposing of it in a biohazardous sharps container? You're going to use a gauze square to break off the needle and place it in a biohazardous sharps container. Are you going to drop the syringe needle first into the biohazardous sharps container? Or do you replace the biohazardous sharps container once it's half full? Give you all a few moments to think, to read that and answer. Okay. Brittany and Veronica says A. I'll wait a few more moments. Let you okay. Kiara says A. Maria, Erica, and Brett says C. Okay, let's see. Okay, the answer is C. Those of you that said C is correct. You want to drop the syringe needle first into the biohazardous sharps container. Why is A not the answer? Because we're never going to recap a used needle. Never, ever. Never, ever recap a used needle. Okay. You can recap a needle that, you have drawn up and you're not ready to use it yet. So let's just say a patient, you have some injections to give, but you have to draw up several different syringes. Then of course you got to recap it. And even then, the way you recap, you use what's called the scoop method, meaning you put the cap down on the table and then you scoop the needle into the cap. But we never will recap a used needle. Okay, ever. Veronica says you may get stuck. That's absolutely correct. And B, so remember I mentioned earlier about ruling out certain answers, right? Automatically B, we already know we're not going to do B because that says using a gauze square to break off the needle. We're not breaking off the needle. And then D is not the answer because we don't have to replace it when it's half full. We can replace it when it's 3/4 full. Okay. The answer is going to be drop the syringe needle first into the biohazardous sharps container. All right, next question. When preparing the patient for halter monitoring, which of the following actions should be taken? Are you going to vigorously dry the patient's skin prior to electrode placement? Apply the electrodes while the patient is in a standing position? Ensure tension is on the lead wires after electrodes are in place? Or are you going to wash the patient's skin with soap and water prior to electrode placement? Thank you. Christasia, I hope I'm saying your name right. Only if it has a safety device as well. Yes, you want to activate the safety device. Thank you for mentioning that. Yes, you want to lock your needle or activate the safety device. Now, a lock can be one of those locks where you have to actually click and, click the lock over the actual needle, or you may have a safety device in which the needle is retractable. So you actually, as soon as you give the injection, you never pull the needle out of the patient's arm. You can just hit the little button and the needle will automatically retract into the barrel. So yes, thank you, Christasia, for mentioning that safety device. All right, looks like okay, Kier, Janice, I hope I'm saying your name right. Maria, Tessir, Brittany all say A. Veronica says B. Anybody else want to chime in? Erica says B. Okay, let's see. Okay, so if you said A, you're correct. You want to vigorously dry the patient's skin. What are you going to dry it with? You want to you use a gauze. Well, at first you want to clean it with alcohol. And then you can also use a gauze to go over the area to dry it. You want it to be very dry when you are placing a halter monitor because you want those electrodes to stick. So the answer is going to be A. B, the patient can be lying down or sitting. In some cases, maybe the patient will stand, but it's not an absolute that the patient is standing. The patient can be sitting, lying, or standing. C, in short tension, we actually want to make sure there is no tension on the wires. Wash the patient's skin with soap and water. That's unnecessary. You just use alcohol to clean the area, and then you can use gauze. Oh, okay. Veronica says vigorously. Okay. It sounds a little aggressive, huh? Vigorously sounds aggressive. I can see that why you would think that that's, But yeah, that just means that you want to, go over the area several times just to make sure it's nice and dry. I can see how that can throw you off. Oh, Christasia said I said her name right. She says, I'm currently in school for medical assistant and I'm going in an externship on May 17th. Perfect. Which certification exam are you taking, Christasia? Let me know if you're taking CMA, CCMA, or RMA. All right, next question. Psoriasis can be identified by which of the following characteristics? Yellow and waxy, gray and crusty, silvery and scaly, or brown and flat? Veronica says she's also going on May 17th. Okay, Veronica. Psoriasis. Tayseer, I hope I'm saying your name right. I'm so sorry. Tayseer, I'm so sorry. Says C. Erica says C. Maria also says C. Psoriasis. Veronica says C. All right, let's see. So yes, C is correct. Silvery and scaly. Silvery and scaly. Psoriasis can be identified by silvery. Psoriasis is silvery, scaly skin. Okay, when preparing a patient for a physical examination, which of the following should the assistant take first? Give the patient a paper gown, verify the patient's identity, record the patient's vital signs, assist the patient into the Fowler's position. Okay, let's see. All right, looks like Christasia says C. Maria, Tajer, Veronica, Kiera, and Janice says B. Okay, let's see if anybody else. Okay, Brittany says B. Let's see. The answer is B. You want to verify the patient's identity. So one thing too I want to mention to you all with these questions, these keywords first, initially, priority, those type of words you want to pay attention to, because all these things we'll probably do, but what are we going to take first? We want to first verify the patient's identity. Before you do anything with a patient, you always want to verify their identity. Have them state their name and date of birth. You don't ask them, hey, is your name Murray Smith and your date of birth 5/5/75? No, you're going to let them state it to you. So you verify their identity, and then everything else will come later. Okay. All right. Brittany says, I purchased the study guide, the NHA study guide. Was it worth it? Absolutely, Brittany. Absolutely. Go through that study guide. My students are actually going through it now. They're taking their test next week. The study guide has all the modules that you need to know for the test. So, and that goes for anybody on here that's taking an NHA exam. Go ahead and purchase that study guide. You can purchase the study guide and the practice test. I do recommend it. I think it's worth it because, as I mentioned, it goes over every single module that you need to know: scheduling, compliance, terminology, patient intake, every single thing that you need to know. So yes. Oh, Christage, I'm sorry. That was C for the psoriasis question. Oh, sorry about that. That wasn't for that. Okay, thank you. I'm my computer, my phone. I'm on my computer, but I'm looking at everything from my phone, and there's a delay. Sorry about that. Okay, which of the following can be signed by a medical assistant? A medical report for an insurance carrier, a referral letter for a patient to an outside provider, a letter containing medical advice to the parents of a child, or a notification letter to a patient about surgery arrangements. Which of the following can be signed by a medical assistant? Which of the following can be signed by a medical assistant? Veronica says, how and where can I get the NHA study guide? Veronica, you can go on the NHA website. So with my school, we have our students sign up and we get our students register on the NHA exam. I'm sorry, on the NHA website, and then they can register for the exam there, and then you can also buy the study guide. So I don't know if your school is going to get you registered or if they're going to have you register yourself. So I will reach out to them and ask them, but it's on the NHA website, nhanow.com. Okay, so for the most part, everybody's saying D. One person says A. Let's see. Okay, so the answer is going to be D. The other items are all going to be signed by the provider. So a medical report signed by the provider, referral letter for a patient, provider, medical advice definitely, because we already know as medical assistants, it is outside of our scope to give medical advice. So that is one of those ones that we can automatically look at and rule out. But a notification letter to a patient about surgery arrangements, like letting them know that, their surgery is going to be on this day. They need to show up at this time and fast at starting at this time. Yeah, absolutely. We can sign that letter. Everything else is outside of our scope. When administering an intramuscular injection, which of the following actions should the medical assistant take? Select the patient's forearm as the site of the injection. Cleanse the site in a circular motion from the center outward. Cleanse the site with povidone iodine solution, or hold the needle and syringe at a 45-degree angle to the skin. Intramuscular injection. Okay, Maria, Britt, Brandon, Tasia says B. Okay, anybody else? Okay, Kiera, Veronica, Erica also says B. All right, let's see. Very good, ladies. The answer is B. Christasia also says B. Yes, you're going to cleanse the site in a circular motion from the center outward. Okay. So these other ones, we can rule out the forearm. We're not giving an intramuscular injection in the forearm. That's an intradermal injection, PPD. Well, that's what we give in the forearm. D, hold the needle and syringe at a 45-degree angle. Absolutely not. That's a subcutaneous injection. Cleanse the site with povidone iodine. We don't have to sterilize the area. Povidone iodine is sterile solution. We don't have to do that. So the answer is cleanse the site in a circular motion from the center outward, because you want to wipe the contaminants away from where you're going to be injecting. Very good, ladies. All right. Which of the following notifies the provider of a claim denial by an insurance company? Is it a remittance advice, coordination of benefits, eligibility for insurance, or is it a CMS 1500 claim form? So this is good. This is an administration question. So you will have some administration questions. I think the majority of the questions we've seen so far have been clinical, but there will be some administrative questions. All right, Christasia says A. Tasia says D. Maria says A. Okay, A, D. I see some A's and D's. See A's and D's. Okay, so we're going to talk about this one. All right, so the answer is correct. The answer, those of you who answer A, is correct. Remittance advice. So what is remittance advice? That is a explanation of benefits that goes to the provider's office. What is the explanation of benefits? It lets us know what was covered by the insurance company. It just gives the claims detail, like what was covered, was anything denied, how much was applied to the deductible, right? That's the remittance advice. And the explanation of benefits, that version goes to the patient. So remittance advice and explanation of benefits, they both pretty much do the same thing, but the remittance advice comes to the provider. Explanation of benefits goes to the patient. So if you see an option about the explanation of benefits, just know that's the one, the claim details that goes to the patient. Coordination of benefits, what is that? That is the process of determining which insurance is primary or secondary. So if you have a patient who has more than one insurance, you have to coordinate those benefits. If she has two insurances, we can't bill both insurances because then the insurance payments can overlap. The provider is overpaid, and then they have to send that money back. So you want to bill the primary insurance first, and if something is denied, then we bill the secondary insurance. Okay, that's the coordination of benefits. Eligibility for insurance, that means that the patient is eligible, their insurance is active. And then CMS 1500 claim form, that is the claim, the universal claim form. That is what we fill out to send the claim to the insurance company so that the doctor can get paid or reimbursed. Okay. So again, good things to add to your notes, mental notes and actual written notes. Okay. Because if it's an option on here, it's going to be on the test. All right. What is the purpose of a modifier when assigning a CPT code? Indicates the complexity of a medical history that led to the procedure. Does it indicate the amount of time the provider has spent on the procedure? Provides the clinical setting in which the procedure was performed. Provides additional information or circumstances for a procedure. The purpose of a modifier when assigning a CPT code. Okay, Christasia says D. Maria, okay, D. Tasia, Veronica also say D. All right, let's see. So if you said D, that is correct. Erica and Kiera also said D. Yes, so that is correct. So a modifier, I mentioned it earlier. If you were late, you missed it. And if you didn't catch the beginning, you missed it. But that's the purpose of a modifier. It provides additional information about the procedure, like whether there was multiple providers who perform the procedure, whether they happen in different locations, any special circumstances. It doesn't indicate the complexity of the medical history that led to the procedure. It doesn't indicate the amount of time. The code itself can indicate the amount of time because CPT codes, there's certain codes that the doctor can choose to indicate whether he was with the patient for just a few minutes or if he had to spend an hour. The code itself will tell the insurance company that. And then the clinical setting, it doesn't do that. It doesn't provide that information. The point of service code will provide the information. Place of service code, not point of service code. Place of service code tells the insurance company where the procedure was performed. All right, very good. All right. Which of the following instructions should an assistant give regarding transdermal patch? Regarding transdermal patch in use. Only sponge baths are allowed while wearing a patch. Make sure to rotate the patch placement to avoid skin irritation. Keep all used patches for inspection at your next appointment. Or apply each new patch at a different time during the day. Regarding the transdermal patch and its use. Okay, so far I see B. Anybody else? All right, let's see. The answer is B. So sponge baths are only sponge baths? No, the patient can take a shower. Keep all used patches. Well, we can already rule that out for inspection. The doctor's not going to need to see the patches. Apply a new patch each day. That will be incorrect because at a different time during the day, that would be incorrect because if anything, if they have to change it every day, they will want to place it at the same time, not a different time. So when you have a medication that you have to take every day, most of the time you have to take it at the same time for it to be effective and um, equally distributed. Okay. When using the SOAP format, which of the following will be found in the assessment section? Family history, laboratory results, chief complaint, or the diagnosis? The SOAP format. Family history, laboratory results, chief complaint, or diagnosis? Okay, I see C, I see D. Okay, I'm seeing C and D, mostly C's. All right, let's see. So if you chose D, that is correct, the diagnosis. Let's talk about this. Let's talk about this SOAP format. So what is a SOAP format? That is a charting format, right? Medical record format. SOAP is the acronym for subjective, objective, assessment, and plan. Okay. The subjective part of the SOAP medical record is what the patient tells you. So SOAP is what the patient tells you. So family history could go under subjective. Chief complaint would go under subjective because it's whatever the patient tells you goes under subjective. Objective is the part of the medical record that you can measure or that you can see yourself. So, like vital signs, anything that you can physically see on the patient, that will go under objective. So, and like I said, that you can measure. So, laboratory results can go up under objective. Assessment is the doctor's diagnosis or his impression. Maybe the provider does not have a diagnosis yet, but he has an assessment. He has an impression, and so the plan, he may choose to send the patient for blood work. So he would put that in the plan section, or maybe he wants to see the patient back in 2 weeks, or send them for a stress test or an x-ray. That's the plan. Okay, so that's the SOAP method: subjective, objective, assessment, and plan. All right, I think we just about done. We got a few more. According to the RACE acronym, what is the first action an assistant should take after discovering a fire? The RACE acronym: close the doors and windows, turn off the oxygen in the adjacent exam rooms, use the office fire extinguisher, or evacuate staff and patients from the immediate area. The RACE acronym. You've discovered a fire. Okay, D. Everybody's saying D. Okay, let's see. D is correct. So the RACE acronym, right? So RACE, the R in this acronym means rescue. So you want to evacuate the staff and patients from the area. The A is alert or alarm. That's when you're going to, pull the fire alarm, call 911. C is confine or contain. That's when you want to try to close off the area. So A, close the doors and windows would go under C. Turn off the oxygen in the adjacent exam rooms. And then E is extinguish and exit. So C will go under extinguish. Use the office fire extinguisher. All right. When controlling bleeding, so you're performing first aid, right? What should you do? Apply layers of sterile gauze, sterilize your hands, suture the wound, or flush the wound with sterile water. So the assistant is trying to control bleeding, doing first aid. Should she apply layers of sterile gauze? Should she sterilize her hands, suture the wound, or flush the wound with sterile water? Okay, looks like everybody agrees that it's A. Let's see. That is correct. You want to apply layers of sterile gauze, so you don't have to sterilize your hands. If you're um, assisting with a procedure, yes, you have to sterilize your hands, suture the wound. That the provider would suture the wound. As medical assistants, we can remove sutures, but we don't actually suture the wound. Flush the wound with sterile water. If a patient has a wound that needs to be cleaned, then maybe. But in this case, you're controlling the bleeding. So we're going to apply layers of sterile gauze. And I believe this is the last question, ladies. When drawing blood, when should the tourniquet be removed? After the needle is removed? After a flash of blood is seen in the hub of the first tube? Within 1 minute of application? Or between 2 and 3 minutes after application? All right, so I'm seeing C, I see B, and I see C. Okay. All right, let's see. C is the correct answer. So when you're drawing blood, you want to have that tourniquet off within a minute, okay? So not after the needle is removed. If anything, you want to actually remove the tourniquet first before you remove that needle. After a flash of blood is seen in the hub of the first tube, no. Within 1 minute of application, definitely not 2 to 3 minutes after application, but within 1 minute. Okay, everybody. So this is it for today. I hope you all enjoyed this. I hope that this was helpful. Feel free to, rewatch it if you need to. I will do a part two to this. The live that I'm doing tomorrow night is actually going to be part two to the certified medical administrative assistant exam. So feel free to tune into that one as well. But that's going to be for the administrative side. That's part two. Part one is already on my channel. So I hope that this was helpful. Please let me know. I know Kiara says she's taking her test Friday. Let's send Kiara some good vibes and prayers. Kiara, I hope you pass your test on Friday. For those of you that's about to go on externship, I wish you all the best with that. Please keep me posted. Let me know. If you missed the beginning, let me just go back to the beginning really quickly. I shouted out some people who had passed their certification. So if you do pass and you want to be featured on the channel, let me know and I will post it. So this one here, I blocked out the names because I did not get permission. But if you want to be featured, if you pass and you want to be featured, let me know. I will feature you in the next video that I do. You're welcome. You all are welcome. Do me a favor if you haven't already, like this video, exit out the chat and like the video for me so it can get out there. And comment down below and let me know if you have any video suggestions. I am taking suggestions. I am actually about to go out of town next week, but so I won't be doing any videos next week, but I will have some time after next week to do some videos. So let me know if you have any video suggestions. I'm going to be doing the externship do's and don'ts. I'm going to be doing part two to the CMAA exam tomorrow. I'm going to have a video coming up explaining the differences between the CMS 1500 claim form and the encounter form, because I'm noticing people are getting those mixed up. So I'll have all of those coming up. And then if you have any other suggestions, definitely let me know in the comments once this video posts. And Veronica says she's doing administrative and a volunteer, no clinical. Got you. Okay. All right. So for those of you that's going to join tomorrow night, I'll see you then. And if not, I'll see you all when I post this CCMA part 2. You all have a great night. Um, she said, what is the difference between CCMA, AMA? So AMA is the organization, and CCMA is the actual exam. So AAMA is the organization that administers the CMA exam. Taser, the CC, the C. Okay, so let me back up a little bit, and I'll probably do a video on this just to clarify more. But the AAMA is an organization that administers the CMA, the Certified Medical Assistant exam, and the NHA is an organization that administers the CCMA exam. So I hope that cleared it up a little bit. So AAMA and the NHA are the certifying organizations. The actual certifications are CCMA, RMA, CMA, and then CCMA. So I hope that helped. Um, I hope that helped. Christasia says she's taking a CMA exam. So yes, these questions also help for that. We did the CMA at my former school, and these is the same kind of questions. Even though the CMA and the RMA, they actually go, they're a lot broader, so you will see a lot more administrative questions on that. So I do recommend you, this helps, but I do recommend you to also look up CMA specific questions as well. Okay. Tasia says make a video about that, please. Yeah, I'll do that. I'll break down the differences between the CCMA, CMA, and all that good stuff. I'll do that. Veronica says she'll join. Okay, tomorrow. Okay, it'll be the same time, Veronica, 9:15. All righty. You're welcome. All righty, you all. Thank you so much for staying here with me for over an hour. And you all have a great night.